The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome to our second webinar in the series of those on privacy. My name is Mandy Shields. I'm the Health and Service Coordination Project Officer with Hume Whittlesea Primary Care Partnership. This series of webinars are a public-private partnership between Hume Whittlesea PCP and GEMBA. Thank you very much for attending and welcome.
Good morning, everyone, and thank you, Mandy, for that introduction. My name is Nihal Samra. I'm the General Counsel and Legal Director of the law firm GEMBA 360. We are delighted to be working with the PCP in supporting these series of webinars. Today's session is on the privacy and client records, but we have extended that after discussions and questions from last week around documents, privacy information as well too. As always, a copy of these resources will be uploaded into the My Network portal, and that's just located in this section here. You can access those through the Hume Whittlesea PCP website and by clicking on the My Network portal. We have, over the last week, added people to the privacy chat group. We can see the people that are listed here as part of those discussions. Certainly, if you have difficulty accessing that portal, by all means drop Mandy an email or our support desk an email, and we'll certainly look at ensuring that you can log in. All of the information, PowerPoint presentation slides, and also the copies of the today's session will be recorded and be also uploaded into the webinar, into the My Network portal itself. So just moving on, this is the second webinar in the privacy series for the PCPs. If you do have any questions around this, please post them on the questions bar. As always, we will be opening up the phone lines to all attendees at the end of this session. And so if you did have any questions, by all means, you can wait till then and ask us. We will ask you to just introduce yourself. There are a few people that have joined us this morning. So just to recap, the reason that the Hume Whittlesea PCP raised these webinars was because there was an interest in the changes to privacy legislation, and also over the last few years there has been a growing public and community expectation for issues around privacy. Certainly, as you can see, there was the Royal Commission's recommendations around opening up information about a victim's rights, and also when we look about the risk and safety in terms of what organisations exactly like yourselves, community health centres, agencies funded by the state and Commonwealth government, what information they could actually share between each other, and also disclosure to other agencies and their clients. This is the second webinar that we are running in this 4-part series. This will cover client record keeping, your legal obligations and record keeping standards. Today we will be looking at why do you need to keep accurate client records, what should be in your records in terms of standards like the SOAP format, which is the still most popular type of standard to use, and also all other quality standards do refer back to these particular standards. We will also be covering off the specific legal obligations for broader document management requirements, which is again relevant to your agency and the privacy legislation as well. As I've said, all of this information will be located within the PCP's My Network portal, and again, it does also allow you to access slides, previous recorded webinars as well too, and also post other information or questions that you might have after this webinar. So let's move forward in terms of the webinar this morning. As I said, we will be covering off some questions briefly that were raised at the end of last session, but also look at the specific legal requirements, statutory document retention requirements for client records, and also other documents your agency should be looking at. Looking at why is it relevant to your agency, but also covering off other important areas like email and other electronic document information. Some of this information around 7 and 8 will also lead into the third webinar, which is around mobile communication and privacy laws as well. As always, we'd like to pay our respects to the elders past and present upon the lands on which we all meet today. While this session is run by webinar, we do pay our respects accordingly. So with it, I would just like to cover off a summary of what are some of the issues that was raised and what you should know about in terms of your agency's requirements. There are questions being asked about privacy, document management, and retention of agency information. Today we will also be posting out a legal memo to all attendees, and these will outline the key legal requirements relating to document retention and highlight some of the legal and commercial risks for unsatisfactory client records and document management, particularly in relation to email and other electronic records. In short, we do like to draw your attention to some of the penalties that you may not know about. Initially, when we raised issues about privacy and health record information, there is significant penalties for organisations who don't keep satisfactory client records or document management, who don't meet document management requirements. There is a new provision in Victoria around the Crimes Act, and it was inserted a number of years ago. Excuse me. As part of that, if you don't keep satisfactory records, you could be fined up to $62,000 individually, and organisations can face maximum fines of up to $300,000 directly. With these individual fines, this particularly relates to staff members. So if they are found to not keep adequate client records or documents, and I'll come to what a document actually is, then they can be fined up to $62,000 per incident, as these might occur. And if an organisation doesn't have appropriate systems in place and allows it to happen, then you can be fined up to $300,000 for each offence if you are found out to have breached this particular requirement. And I will come back to what this actually means. When we look at documents of an agency, particularly privacy can cover, as we did hear from a health service last week, that they have about 3 or 4 different versions of their privacy policy. In particular, what we look at when we talk about documents is that privacy can cover a range of different document types. Obviously, the first one that most people think about is client records, but also you can have whistleblowers documents in terms of staff that might need to disclose information or be allowed to disclose information. There can be work health and safety documents as well too. There can be governance documentation, so things like members registers, directors registers as well. Recently in Victoria there was the launch of the new tobacco laws. So if there are breaches around, for example, clients or staff that smoke within the 4-metre radius, and you do need to report them to the council, which I'm sure people will ask us about, then again, from a privacy point of view, your privacy policy might actually need to cover that new requirement as well. And as we heard from a health service last week, there may well be HR recruitment documents that you also need to cover, privacy policy to cover how you will use that particular staff member's information. So if we go back and look at what is actually required from a legal point of view, in Victoria, the Crimes Document Destruction Act has created a new criminal offence, and it covers all of the documents that I just mentioned. What this act can do is hold managers and staff that directly report to them accountable if they knowingly destroy documents that are or reasonably likely to be required as evidence in existing or even potential legal proceedings. Those are not my words or Mandy's words. Those are actually directly from the legislation itself. The legislation here talks about any document that might be or could be used in potential legal proceedings. So as part of that, organisations can be held criminally liable if a corporate culture exists that encourages or tolerates the destruction of relevant documents. So from a privacy policy and Privacy Act point of view, we do need to look at a privacy statement that really covers all of your documents within your agency, not just the information within your client record system itself. What we have found is that both individuals and organisations can be prosecuted under the Crimes Act, and the penalties are severe. Quite simply, if individuals do not keep appropriate documents and it is managed in an appropriate way, then there could be up to 5 years imprisonment or a fine of up to $62,000 depending on the seriousness of it, and organisations can face a maximum fine of $300,000 per incident. This is under the Crimes Act now in Victoria. We have, as a law firm, actually used this in the past when we needed to gather information from an agency around client information. It is an issue that agencies often do not and are unaware of. And what we have found, where we've delivered a session on this particular topic, is that for staff members, it doesn't apply to staff members that are currently employed. It could also cover staff members that have finished working for your agency, and if they have left, let's say within a 7-year period, then we can actually call them back to ask them where they placed the document within the agency itself. We did deliver a presentation to another community health centre in another region, particularly just on this issue in the last few months. So what this does mean when it is covered is that the Crimes Act not only applies to legal proceedings that are in progress, but also proceedings that may be commenced in the future. So that could include things like work health and safety issues from an HR point of view. It could be risk registers in terms of near misses that have occurred. It could be obviously client records. The 7-year rule applies there. It could also be in terms of agendas, minutes of meetings, etc. And again, it could be a range of legal proceedings. It doesn't have to be just those that are going to court. So as part of this, when we talk of privacy, we do need a much broader, high-level approach to look at, well, what is now going to be covered under the Privacy Act itself. So when we look at this as part of the key legal requirements, if we were to work backwards, there are mandatory document retention periods that are covered, and most of the agencies here are covered by each of these particular requirements. So there are mandatory periods for legislation under the corporations and financial records. There are also mandatory periods for actual or prospective litigation as well too, and again for specific periods that we will cover now. As part of that, what I also want to mention from a privacy point of view is that documents don't just mean client notes. Documents have been found to include post-it notes, photographs, maps, email, electronic documents, PDF documents, CDs, USB devices, backup tapes, and most importantly now, things like mobile phone information, including iPhones and handsets. So when we are looking at a privacy policy and privacy information, we do need to include what a document actually is and what it covers within your agency. For each of those areas and documents, we do have specific retention obligations that you need to be aware of. Again, for things like general company information and financial records, the 7-year rule applies for those records. For things like income tax requirements as well too, financial records as well as other documents, managers and directors, being your board members, CEO and senior management group, generally have responsibilities. And again, the civil penalties are quite, I'm going to say, not impressive or excessive, but quite substantive is the word that I was looking for. And again, for these types of things, if you are a community health centre, you are under the Companies Act, and again, you are required to make sure that you meet these requirements, and you could face civil penalties up to $200,000 for not ensuring that these are in fact maintained. Similarly, for things like financial records, again, you've got the 5-year rule in terms of what applies, and again, penalties for breaches is around $2,000 for per incident that might occur. You might find that if $2,000 compared to $200,000 is not very excessive, but we have found that when you add up each individual item that might occur during a financial year reporting period, often that figure is multiplied by 50 or 100 times by the time it actually is calculated. So for the relevance for your agency is that when we bring it all together under the Health Services legislation and Record Keeping Act, it does mean that you have a general rule of 7 years from the date of last use, unless this does apply to minors as well. But you'll find that consistently across different states and territories of Australia, whether it be Victoria, ACT, New South Wales, the standards and general rules do apply. This does apply whether it is in electronic or hard copy format. It simply doesn't matter, but a document retention policy must detail what these particular retention periods are. Again, from a privacy point of view, it is important that this is stated within your privacy document because it relates to how you're actually holding and whether you will allow for correction during this period of time and what the process is for people to correct the information that you might have. One of the things that we will touch on today is around about emails and other electronic documents. There are some people that still believe that email and other electronically stored information are not considered documents and therefore are not subject to legal document retention obligations. This often leads them to delete emails and other electronic stored information more readily than hard copy documents. The fact is that this belief is not relevant at all, and quite simply the legal definitions of a document is wide enough to include email and now other electronically stored documents. As we will discuss next week, this other electronic stored information leads into things like mobile devices and also social media as well too. So with what we do ask people to look at when we are talking about emails is to separate things out from personal emails having no business content, staff announcements, schedulings of meetings. These types of things may not be considered to be within your client record or privacy information. However, when you start to include things like contracts, financial information, or board papers or minutes or agendas, then that could actually be included within your scope of your privacy documentation because it is actually dealing with staff, client, or business information that your agency needs to be aware of. So within what I will just mention very briefly is that emails do create legal risks for people because they tend to be not very formal compared to letters. and even now with mobile devices, they are starting to raise unique issues about destructions. Simply deleting an email may not have necessarily destroyed it, and we raise this within this privacy webinar because if you do delete an email or you do send information, then you still need to be able to allow clients or other people to actually correct the information if it's incorrect, and you need a way to actually track what is actually being sent through to us. So with it, one of the ways that we do look at client records and the most frequently used process is around the SOAP format. Within this, what we do find is that the role of client records and for staff is that these do vary from staff member to staff member and from program area to program area. I was meeting with an agency yesterday in the Hume Whittlesea PCP catchment area, and we are having a separate session later this afternoon whereby an entire program area actually raised the relevance of keeping health records. The issue was that a program manager actually gave his entire team time at the end of the day to catch up in writing their client records, and even after a week an independent auditor found that their level of record keeping was negligible and almost near nil. They've now had a series of auditors come through, all effectively saying that they need to keep better record keeping standards because, quite simply, as the auditor put it, it's not worth the paper it was written on. So with it, we raise this now because we do find that when that staff in some agencies still don't believe, which is highly unusual in this day and age, that there isn't a need to keep client records. With that, there is significant legal obligations, as we have just covered, but also when we do raise this from a legal point of view, what we do find is that some staff turn around and say they're afraid of litigation and as a result don't want to keep client records. What we simply do say to those staff members is simple. Keeping good records gives you a good legal defence. Keeping no records gives you no legal defence. And quite simply, at times, we've informed CEOs that if there are no client records and this is a consistent course of action, then quite simply get ready to open up your checkbook in terms of what you need to do. So moving forward, the self-documentation is the process that a lot of agencies do use. We find that this process allows for subjective data, which is the information that a client tells you about their symptoms. Objective data relates to physical examinations. Assessment leads to the impression that patients or clients' problems that leads to diagnosis, and the plan is the course of action that you are intending to provide. This by miles tends to be the general way that every health service facility around the country, practitioners are required to accurately document what has happened during a client visit. I will also raise that in the last week, the Victorian State Government has now released their new quality plan in terms of what they're expecting agencies to do. And this is certainly one of the major priorities that they have documented within their 140 plus recommendations. Over the last 10 years or so, there is a change from this should be done to something that now must be done well. We find that it seems that very few practitioners are, though, able to write clear and concise clinical case notes, and often most complain about feeling frustrated when trying to distinguish, I've noticed that there is a spelling error there, what is and what is not important as part of their notes. This is both from a legal point of view and also from a service point of view. What we do recommend is simply going back to the SELF method, we do find that this is the most effective way of prompting them to do things. Often we find that the frustration is more about how much to write, and we often just ask them to summarise what they're actually talking about. This should be done from a clinical governance point of view and quality standards point of view as part of the general clinical governance supervision or scope of practice work. Again, it is important from a privacy point of view of what information is actually being recorded. We do find that the SELF notes are part of what they call the problem-orientated medical records process. This is commonly used by health practitioners in most primary health service agencies, and the SELF notes are intended to improve quality and continuity of client services as well. There are other methods that we do recognise, but we now find that even AHPRA are recommending these types of methods in terms of documenting their record notes. So if we were to really drill down into how SELF is used and where it is used, it is used around the clinical assessments in terms of containing information gathering during an interview and reasons why the client is seeking this treatment. We look at the problems list in terms of including all the problems and understanding of the risks associated with these. I will add that the risk part is actually important here because this is one of the issues around consent and where privacy links to consent, and the idea is that a client needs to provide informed consent before a practitioner actually delivers the service. And if we are looking at from a SELF format, it actually could reduce the issues that clients might have in the future, where a practitioner, if they are identifying what the problems are in their client records and informing the client about how they intend to overcome these problems, then that then leads to the treatment plan, and also informed consent is part of the standard client delivery that each practitioner is actually doing. And effectively that then leads to the progress note itself. So within it, if we were to look at SELF notes and what a standard process is, then this slide here does give you a really, I'm going to say nuts and bolts process of what should be in the subjective part, what are the definitions, so things like what does the client tell you, what are the pertinent information that you might gather. In the first session we spoke about gathering information from a privacy point of view from a carer or another person apart from the client that's sitting in front of you. And then it talks about things like looking at the client's feelings, concerns, plans, and you get that general information of what you actually do see. Each one of these sections, the subjective, objective, assessment and planning elements, are broken down in this table here, and it gives you the information that practitioners should follow to avoid legal issues, obviously, but also to improve client care, which is why we keep client records in the first place as well. From a privacy point of view, again, things like examples of how you are actually using client information is found in the examples column. We will be looking at over the next couple of weeks examples of privacy policies, and happy to also look at sharing some other agencies' privacy policies and working through those over the next few weeks as well. So when we look at this from a case study point of view, I won't go into this in too much detail today. This really gives you some idea of a typical client record using the SELF format. I only raise this only because we don't need to actually have headings of SOAP, which I have seen in some client record keeping files after we've delivered this session. So within it, it has then been summarised into this format, and often agencies find this quite useful in taking this information away. You can see that this was something that was done back in 2001, but it just gives you an idea of how a client record file could be kept during clinical supervision should your agency wish to use it. So just to finish off, some list of recommendations before we open up the phone lines for all participants is that we do consider that agencies review and update your agency's document management policy to look at things like creation, storage and deletion of emails, and also match these back to your privacy policy itself. We were asked last week to have to circulate a privacy policy. We have actually held that off just because we wanted to talk about the agency's document management policy. We believe that the two need to be run and drafted together because, as you can see, when we are talking of privacy, client information, or the information your agency might hold from a privacy point of view is actually much broader than just client notes themselves. So with it, after this is done, we are recommending that you circulate these policies to ensure that staff are aware of them. We will open up the phone lines. I'm sure there will be some questions around this as well too. I can see Mandy here has taken some notes and will also raise questions as well. But we will open the phone line and happy to answer any questions that people might have.